Most veterinary practices are capable of delivering high-quality health care to pets, and most of them do. Every veterinary healthcare team believes that it is providing the best care possible for its patients. However, compliance, the idea that pet owners will follow through with their veterinarian's instructions at home, is a key element to high-quality veterinary care. Dr. Shelley Rubin, the 2003 American Animal Hospital Association Practitioner of the Year, puts compliance at the top of the list for guaranteeing the best care possible.
Compliance to me really indicates the situation of giving the best possible care to our pets, our patients, and making sure that those patients actually get that care. That's how compliance, that's the way I look at compliance. Do our clients actually continue to do what we suggest they do? And that way we know that by far they're getting the best care possible.
But that's not necessarily the case if pet owners are not following doctor's orders. Practitioners who believe clients are complying with their recommendations might be in for a big surprise. A comprehensive study by the American Animal Hospital Association shows that millions of dogs and cats are not in compliance with what veterinarians consider to be the best wellness care or treatment of medical problems. In fact, the American Animal Hospital Association study showed that the level of compliance was significantly lower than what practice teams believed.
One of the problems that I noticed in our practice, and we have a multi-veterinary practice here in Chicago, but one of the problems that I noticed was that our thinking of what our compliance was obviously much higher than it really was. In other words, when you start doing some measurements and looking at records and making phone calls, you find out that that patient that you thought was giving the prescription food or you thought was on heartworm medicine 9 months out of the year really hadn't been on that because they never followed through. And then you kind of look at yourself and you decide, well, you know, whose fault is that? Is that the client's fault or is it our fault as professionals? And I realized that the fact is that it's probably a shared fault.
The American Animal Hospital Association study confirmed that veterinary practitioners indeed tended to overstate compliance levels. For example, veterinary practice teams estimated an average compliance level of 74% with their heartworm preventative recommendations. However, a survey of 1,000 pet owners who were part of the study showed only a 48% compliance.
So in our busy practice, you know, if I recommend to somebody that they need a dental prophy, let's say, they have severe periodontal disease, and we want them to get their teeth cleaned, and I say, now we need to make an appointment so that we can get Fido's teeth taken care of. And that's fine. They walk out of the room, they go up to the front desk, I write on the fee slip that please make an appointment for a dental, and the way our team works here is that my staff then will follow through and make sure that that person gets an appointment. Now, we took this a step further because we really realized that most people will say, well, I have to look at my calendar or I'll call you. Well, they really don't call. They forget. Everybody's got a very busy life today and they don't have time to do those things. So consequently, now what we do is we'll make a list and then we'll call those people. We'll give them about a month and then we'll give them a call and say, you know, this Dr. Rubin calling, Dr. Rubin's office or Blum Animal Hospital calling. And we just want to remind you that last time you were here, Dr. Rubin recommended that you get the teeth taken care of. You know, really, if you start measuring and looking to see how compliant your clients have been about the care given to their pet, I think you all will be very surprised to find out that what you think is really good is really very poor.
Some of the key findings revealed additional compliance gaps. In the use of core vaccines for dogs and cats, the study showed a compliance rate of 87%, meaning more than 12 million dogs and cats across the country are left unprotected. With heartworm testing, clinics were achieving an average compliance rate of 83%, but that still meant 7 million dogs in heartworm endemic areas were left untested.
You know, heartworm compliance is low. Oftentimes in our area, rather, of the United States, we're not recommending 12-month heartworm prevention, but we are recommending 9-month in our area. And we'll find that the following year when we do our blood checks, like most of you do in the spring that are in the northern part of the United States, somehow or another the client has heartworm medicine left over from last year. and you know you only gave them, 9 pills or whatever it is to last the period of time, and so you realize that there's a compliance issue right there, and I think that's a very important issue for us. So that's an issue that has to be taken care of internally. I mean, you can't force somebody to obviously give a pill every month.
With dentistry, the compliance rate was only 25% among pets with grades 1 through 4 dental disease, meaning that almost 16 million dogs and cats are in need of dental prophylaxis. The lowest compliance rate involved the use of therapeutic diet, where only 7% complied. A not-so-subtle financial message also emerged from this survey. Veterinary practices can significantly increase their revenues by increasing their levels of compliance modestly. For example, in an average practice with 2 full-time veterinarians and 3,500 active patients, a 10 percentage point increase in compliance means that an average practice would provide 1,300 more treatments and earn $133,000 in additional revenue. A 25 percentage point increase in compliance means 2,700 additional treatments, equating to more than $308,000 in additional revenue.
There are many ways that a veterinary practice can improve compliance, and it isn't really only a way of making more money, because I don't think in my mind that that's the issue. Sure, we could do better with the number of clients we have, and obviously we can increase our bottom line. But I think what's more important is that in the long run, we are actually saving the client money, because if they're compliant with the care that we want their pet to have, the medical costs will be less because they aren't going to have a crisis later on.
The American Animal Hospital report confirmed several barriers to compliance, including client education and communication issues, the trouble of conveying a lot of information, as well as incorrect assumptions by the veterinarian about pet owner responsibility and their interest in compliance. Money was not one of the barriers. In the pet owner section of the study, only 1 out of 10 pet owners agreed that veterinarians' recommendations regarding additional compliance treatment was motivated by a desire to make more money. In fact, 90% of pet owners wanted their veterinarians to tell them about all treatment options, even if they might not be able to afford them.
And the other issue is that I found is very important in our practice, and I learned this many, many years ago. You must offer the best possible for that client or patient at the time that you're talking to them. You can give them some alternatives, but start with the best, because I think if you start with the least, that's the one they're going to grab for. And it's our obligation to be able to offer the best in order to make sure that that patient gets the best care.
The American Animal Hospital Association's landmark study has shown that compliance with veterinary health care standards is low. The study further revealed that the profession does not consistently recommend the treatment that represents the highest quality of veterinary care. Pet owners are getting a standard of care that is less than what they want, and the veterinary profession is providing a level of medicine that is not as high as it can and would prefer to provide.
Compliance is a big issue, and it always has to do with the fact that the veterinarian and his team or her team must work along with the client to make sure that that pet gets the best possible care and follows through on the recommendations that we make as professionals.